Now, Marin County has one of the highest breast cancer rates in the U.S. How do you address this with your patients?
That's a very time-sensitive and important question. It really is. So I teach women how to do breast self-exams, which I think is very important. It's empowering. Women need to have either a test called thermography, which is an infrared picture, a mammogram, and if needed, a sonogram. So all those tests are readily available, can be ordered by any clinician. What I've found is that the few patients that I have that have had breast cancer, almost all of them found it themselves. So I think that that's really important for people to know.
Yeah.
There's an ongoing study called Marin Women's Breast Study. And in 2009 and early 2010, they have given us a few important tidbits. We thought that Marin County the women here have more mammograms, consume more alcohol, and they have their babies later in age. And there was a premise that felt that these three things contributed to our high incidence. That is not true.
Good.
Which
makes sense.
Which is good. The other group that has this high incidence is in New York, and the same has been true for them. So there's something about our two areas that gives us this high incidence. There's a new study going on that I'm excited about because it's about young girls ages 8 to 11, and what the criteria is that they need to take sugar out of their diet, the bad fats, so no McDonald's French fries, and they need to start exercising.
Okay.
So in 10 years, these women will be maybe 20, and it'll be wonderful to see what the difference might be as we follow them, I think, over their lifetime.
Yes, very definitely.
So one of the things that I recommend to my women is, if they're not vegetarians, consider more vegetarian meals every week. There's a lot of information about meats, especially non-organic meats, causing what we call inflammation in the body. And we think of cancer as being a form of inflammation. The sugar as well. I actually was just in an all-day class on the immune system. Sugars cause inflammation, so, except fruit, of course.
Right.
So if I could just oh, okay, we have 5 minutes, okay. What is a bad fat? Well, we just talked about the French fries. If you're going to be sauteing your vegetables, use olive oil, or in a non-stick pan. You don't need a lot of oils.
Nice and easy.
Nice and easy. And whether I'm seeing a teenager or an 80-year-old, a lot of what I do is educate and listen. The exam part of I spend an hour with a new patient visit. The exam part is 5 to 7 minutes. The rest is doing an intake of their history, their family history. What is their nutrition health? What surgeries have they had? Maybe they're bringing me blood tests that I can review with them. When I do review blood tests, I look at it from what's called a functional medicine range, which is different than most of the lab tests that we're getting.
Okay.
So I'm not a primary care clinician, women's health care expert, yes. I want all of my patients to have a primary care expert.
That's great.
And if I could just mention here, since we're talking about breast health, on Saturday, May 21st, from 10 to 12, the San Rafael Chamber is sponsoring a free talk called Optimizing Your Breast Health. And I will be one of the presenters along with Donna Marie Skippa, who's a nurse practitioner and a thermographer, and Deborah Reardon, who's an Ayurvedic practitioner and a nutritionist. So it's free to the public, and it will be in San Rafael, and it will be on the website very soon. We're creating our flyer for it.
Oh, good. Okay, good. So people can go to the website to find out.
And the website is www.srchamber.com.
Okay.
And yes, you can go look it up. It'd be wonderful to have people come. It's free.
Good.
Yeah.
All right. Well, wonderful. Thank you so much. Now, tell me, can you tell everyone the website for the Whole Health Associates?
Oh, thank you. Yes. It's www.whole, W-H-O-L-E, health, all lowercase, .tv, like television, like what we're on now.
Yeah.
And you will see pictures of the practitioners and little bios, and you can download forms. So it's, I'd love some feedback about what you think of our website. Yeah.
Good.
Thank you, Mary.
Oh, you're very welcome.
Thank you.
And thank you very much for joining us. If you would, tonight Stacy gave an overview of what she does and the different stages of a woman's health. But if you would like to have more information about a specific topic or an age group, let us know and we can have her back, most certainly, to give us more in-depth knowledge of that particular issue. I also want to thank you very much for coming and giving us such a thorough overview of what you do. It does sound like you have a lot of fun. And
I do have fun. I mean, why shouldn't people have fun in their job? That's my opinion.
That's
Yeah.
right, absolutely.
I really appreciate Mr. Optimus asking me to come.
Good. Well, we are very happy to have you here.
Thank you.
So with that, have a great day and we'll see you next time.